No one should be put in a situation where they have to choose between availing health services and feeding their family members. Often the poorest are the hardest hit. Those with little income to spare face the higher risk of disease and are plunged further into poverty when paying for the healthcare services. The speaker we have now, Ms. Asna Hassan, is from St. Joseph's Convent School, Karachi.
Building a fairer and healthier world. My name is Asna Hassan and I'm from St. Joseph Convent School. Dear fellow delegates and organizing teams, Assalamu alaikum. Firstly, I would like to thank Hamdard Foundation for organizing the 29th World Health Day campaign and for giving the students an opportunity to speak on such a topic. COVID has impacted our lives immensely. It was unexpected, forcing us to adapt to the rapid changes that overtook the world. Global lockdowns, digital education systems, switch-ups in businesses, etc. COVID has had its own negative impacts, tons, and people have been forced to suffer through them. But every cloud has a silver lining, and even through all the suffering, pain, stress, loss, there are some positive aspects of COVID as well, although hard to realize. COVID has made health awareness reach to people more than it has ever been preached. Sure, not through the best means, but still, awareness is being spread faster. Kids are growing up learning that wellness is more important than disease and precaution is more important than cure. Lockdown has made people follow the preventive measures and take care of their personal hygiene, which is setting an example for the younger generation. Alice Pong, a medical director for infection control at the Rady's Children's Hospital in San Diego, California, says, I think this is going to be a good lesson for everybody. The public is seeing why public health officials have advised them to stay home when they feel sick, and why they've emphasized hand washing and covering a cough or sneeze. Kids growing up now will know this is how germs are spread. COVID has made us realize what's really important and what's not. There was a wedge between relationships. We were all so caught up in our lives that we barely had time left for the people back home. It was ironic how we knew more about people's life online than we knew about people living with us. We all were so caught up in competition and in trying to fulfill our definition of living life that we forgot what it really meant to live life. What it meant to live in the moment without worrying about work, school, or social media. Before COVID, if someone asked you, when was the last time you made time for yourself and for your family, where you weren't worrying about social media, work, or school, the answer would be same. In a long time. This pandemic has made us do the important things we were avoiding. And even though not in the best conditions, but COVID has forced us to take a break and to slow down and spend quality time with our families. It has made us to stop thinking about what we think is important and made us realize what's really important. COVID has also affected environmental issues. Due to the lockdown, air pollution has decreased significantly and has made skies clearer and blue. And though the change is only temporary, it made us realize how easily we can prevent air pollution if we limit our use of burning fossil fuels. COVID has made many other positive aspects, but in the end, it leaves us with one question. What happens next? After the pandemic, are we going back to our old routines? Would we still act indifferent towards the various awareness campaigns going on, whether it be of mental illnesses, physical illnesses, or environmental illnesses? Would we still prioritize our work more than quality time? Would we still continue harming our environment? The answer is what makes the difference. Thank you.
Thank you, Asna.